Hello, everybody. Thank you so much for being here and joining us for Vision Health of Children with Special Needs. Our webinar today is the third in our series, Empowering Families for Children's Vision. And I thank you. My name is Donna Fishman. I am the director of the National Center for Children's Vision and Eye Health. And I am just going to go through a little bit of housekeeping before I turn it over to our host for the day. We will be sharing resources at the end, so I want to make sure you know that. And also, if you need them, we have certificates of attendance. We'll give you information on that in the end also. And then we will be sending the slides and a recording out to you all as well. Please only put questions in the Q&A box. You can be saying hello to everybody and say where you're from in the chat, but for questions for the panelists, we ask that you only use the Q&A function. So again, thanks for being here. I'm going to very briefly for a moment, just introduce our host, our sponsoring organization is Prevent Blindness. Prevent Blindness, we have a very simple mission of preventing blindness and preserving sight throughout the lifespan, children all the way up through adults and older adults. We do this through patient education and empowerment, professional education, advocacy, and systems change. And the National Center for Children's Vision and Eye Health was formed in 2009 as a way for Prevent Blindness to put a little bit more emphasis on our children's vision programming and to make systems changes to make sure that we have integration of all the systems that you all work in, to make sure that folks in early childhood, special education, public health, in schools, I know we have several school nurses, that all the systems are working together and the federal government has good policies and we have good data. So we push for surveillance and we issue vision screening guidelines. And so we have a plethora of resources on our website. So we are so happy that you are all here today. And mainly our work is about equity. It's about making sure that all children have equitable access to eye care. And we do that through, again, parent education, professional education like this and empowerment, and then systems change. So that's just a little bit about us. I will give a very brief overview of our agenda, which is action-packed. Nicole Pratt will be doing an introduction, then we'll move into, we'll have a parent perspective, talk about the systems that serve your child, best practices for referrals, and then talk about parents as empowered leaders and understand how you partner with your eye care provider. So these are actually out of order. We changed our order and I forgot to change the slide, but these are all the topics that we have today. And I'm going to briefly introduce our presenters that are here today. And we're so honored to have this esteemed group. Their full bios are on our events page, and Anne Wilcock is going to help us, and she's going to put the link back to the events page for you where you registered for their full bios. Nicole Pratt, I'm going to read these in the order they're going to be presenting. Nicole Pratt is a senior parent professional trainer and the Empowering Women Project director and a technical assistance facilitator in the Leadership and Family Professional Partnerships program at SPAN Parent Advocacy Network in New Jersey. Nicole's a single working mom of two young adults who both have special needs, special health care needs. She's a strong advocate for her children and for other families who struggle to obtain appropriate education support. She sits on several New Jersey state, national, and local parent advisory committees, including our National Center for Children's Vision and Eye Health. And she is the co-chair of our work group of our National Center on Children's Vision and Eye Health for children with special health care needs. Nicole Gaici is a wife, mother of two, handler to her daughter's service dog, advocate, and she also is a transition technician in her local school district in Arizona. In her role at the district, she helps students with disabilities transition out of high school and also works with families to educate and equip them for their students' post-secondary success. Her own children are ages 6 and 11. Her daughter has multiple diagnoses in vision and in other areas, and she has volunteered over many years with many different parent advocacy organizations where she's gained support and has risen up through the leadership ranks, and we are thrilled to have her give her parent perspective today. Dr. Robin Adair Shannon is a clinical assistant professor and director of the School Nurse Certificate Program at the University of Illinois Chicago College of Nursing. And I will just say a day late happy School Nurse Day to all of you out there. She is co-editor of the National Association of School Nurses, School Nursing, a Comprehensive Textbook 3rd edition, which is the definitive resource on school nursing. She literally, I love to say, wrote the book. For all of you in school nursing, I know you know this book. She's a leader in several national nursing organizations. She has served in her own days as a practicing school nurse, as an early childhood diagnostic team school nurse, and a nursing supervisor for students with medical complexity in a large urban school district. So we're really happy to have her here. Dr. Sandra Block is a professor emeritus at the Illinois College of Optometry. She's also a global clinical advisor and consultant to the Special Olympics Lions Club International Opening Eyes program. She's president-elect of the World Council of Optometry, immediate past co-chair of our center, National Center for Children's Vision and Eye Health, and she's a current member of the Prevent Blindness Board of Directors. Dr. Block's been a consultant to the Special Olympics since 1995, vast experience, and has been instrumental in developing the vision program globally. She has a keen interest in primary care for children and persons with disabilities, as well as diagnosis and treatment of visually related learning problems. So we're happy to have her. Finally, we have our ophthalmologist today, is Dr. Terry Schwartz, who is a professor of pediatric ophthalmology and adult strabismus at Cincinnati Children's Hospital and the University of Cincinnati. She's also, she's not busy enough, the medical director of the Cincinnati Children's Pediatric Low Vision Program and the West Virginia University Eye Institute's Children's Vision Rehabilitation Program. She has developed and directed pediatric low vision rehab interdisciplinary programs for more than 20 years. She helped establish the Children's Vision Testing Laboratory, and her vision in her research areas include functional MRI in infants with brain injury, visual function in children with cerebral palsy, and early vision intervention. She's also the winner. She has been listed as Cincinnati Magazine's top doctors, which is judged by her peers. And we are honored to have all of our presenters today. I'm going to turn the program over to Nicole Pratt now.
So thank you again for being here today. So I just want to tell you what we've been doing in the last 2 webinars that we have, and you'll be able to get copies of the recordings for these. And so we did one on why vision matters in connection to vision and neurological development disorders. And then we did another one on best practices with vision as part of the IEP evaluation process, early detection, referring to eye care coordination, eye care, and primary providers. And then in addition, how do you follow up with day is closes out our series, the role of family in navigating systems to attain vision care. And so we hope that you will get a lot out of this training today, this webinar today, and hearing different perspectives from parents and professionals alike. And I just want to let you know what the webinar objectives are. We're going to talk about identifying a variety of different systems that serve children with special needs that impact their vision health. And we want to help you to better understand how parents can become empowered as advocates for their children's vision health. And then we'll summarize the importance of partnering with eye care providers to obtain the best possible outcomes for children with disabilities. And now I'm going to turn it over to Sandra Block.
Nicole, thank you so much. Okay, can we have the first slide, Donna? Perfect. So I'm just going to give you a little bit of a background so that you have some sense of where the National Center for Children's Vision and Eye Health stand with respect to the recommendations for vision care, including screenings and eye exams. Next slide, please. From a historical perspective, when the National Center started, our goal was bringing together a number of experts in the field of vision and eye health and have a thorough review of the literature. So any recommendations that we would make were based on solid scientific evidence. So for today's purpose, the article that is important is the one that you see on the slide, which is related to identifying the best practices for screening children from 36 to just under 72 months. I apologize for the dogs in the background. I unfortunately can't control that. Next slide, please. Within that particular article, our goal was to make recommendations about what vision screenings are appropriate for children in that age range. But today's purpose is really to focus on the piece that related to which children should require automatic referral for a full eye exam versus a screening. And I'm going to go through the 6 different recommendations, but I want you to understand that sometimes kids are screened for inclusion purposes to make sure they don't feel like they're left out. So the first thing that we felt was really important is children at high risk for vision disorders and those with readily recognized eye abnormalities such as an eye turn, which is strabismus, or a droopy lid, should automatically be referred. The next major group was children who have known neurodevelopmental disorders such as hearing impairment, cerebral palsy, Down syndrome, a cognitive impairment, who've been diagnosed with autism on the spectrum, have a speech delay. We know that these children often have a much higher prevalence of vision problems based on what the literature, can we go back? Yeah, thank you. Much higher prevalence of vision problems than those that are neurotypical. In addition, we say any child should be referred to with any type of special needs should really be referred for a comprehensive eye exam to an optometrist or an ophthalmologist. Next slide, please. Okay, we're there? Okay. The other things we looked at are things that may put them at a higher risk, maybe not with somebody who is actually identified or diagnosed, but a child who is born prematurely, typically less than 32 weeks of gestation, should be referred for an exam rather than being screened. And if the parent or guardian or even the teacher that works with the child believes that the child might have a vision-related problem, that child should be automatically referred for a comprehensive eye exam. And the last point that I wanted to bring out is because the purpose of screenings is really to identify children in need of further care. Those who have already received comprehensive care, specifically within the last year or 12 months, those are children that probably do not need to be screened, but should be referred back to their eye doctor based on what that eye doctor told them for appropriate follow-up care. Unless something is new or different going on, they should follow the recommendations from the doctor. Next slide, please. I just wanted to remind everybody the reason we advocate for full eye exams versus screenings is really based on what the definition of screening versus exams are. And I just wanted to bring this out to remind you as we start to think about, who's best referred. We know in a screening, the primary purpose is to detect whether there's some early disease or other risk factors for disease in apparently healthy individuals. That is the purpose of the screening. The actual exam is truly a diagnostic test that will identify the presence or absence of a disease entity and the basis for what the next step or the treatment decision should be, whether the patient is symptomatic or not. So just to remind you that there's a difference between an exam versus a screening, and we felt based on the evidence that children with higher risk already identified in the literature should be referred for a comprehensive screening. Next slide, please. And now I'm going to turn this over to Nicole.
Thank you, Sandy. And I just want to thank everyone for taking the time to attend this webinar. As Donna did such a great job of introducing me, I'm Nicole Gaici, and this is my family, my husband, Brett, with our 2 children, Brooke, our oldest, and Blake, our youngest. And as you can see, Brooke is in glasses and has been for almost 9 years. She's 11 now, and being our oldest, as is the case with most firstborns, she was unfortunately our trial and error child. So not only because we were new parents when she was born, but unfortunately, At the time of when she was born, our family was just trying to survive, literally. In my last trimester of pregnancy with her, my husband was diagnosed with stage 3 melanoma and began treatment just a month before she was born. So there may have been very apparent signs that our daughter needed more extensive care in her first year. But being new parents, navigating a cancer diagnosis and the financial crisis that it threw us into, our emotional and mental state was not quite in a place to address any of those signs, no matter how small or big they may have been, as we were simply just not aware of them. Next slide, please. So it's why I truly am grateful that you are allowing me the opportunity to share our story. As often when a patient is being seen, the whole picture isn't necessarily taken into consideration. Our daughter was seen by many providers, starting from the get-go, primary care, specialists, therapists. She had evaluations. We filled out numerous forms, and we had no idea at the time that we were on our way to a diagnosis of a rare genetic condition called Cohen syndrome. We were just trying to answer the crisis that was right in front of us, which at the time was our baby wasn't eating. And at each appointment evaluation, her vision was addressed either by a doctor moving a pencil side to side and up and down, or us being asked if she had a vision screening. And my husband and I, who had 20/20 vision, thought these were adequate ways of assessing if there was a vision impairment. And unfortunately, that was an inaccurate assumption. But at the time, we had no idea a pencil test isn't an adequate way to dismiss or diagnose a potential vision impairment. We answered no when asked if vision was a concern, and we answered yes if we had had a vision screening. And again, we had no idea that those were inaccurate answers. Next slide, please. So thankfully, we did finally receive our daughter's main diagnosis of Cohen syndrome, which led her to finally receiving her vision diagnosis at the time of malignant high myopia. And it was devastating that she went her first 2 years of life with an undiagnosed vision impairment. I thought I was prepared to receive her diagnosis. We had waited over 7 months for the exome whole gene sequencing test, and we just wanted answers as to why our baby kept getting diagnosis after diagnosis added on and not understanding how they all tied together or why she had these. And all I wanted to hear at her diagnosis appointment was it wasn't life-threatening. And that's exactly what the geneticist said, was that there is no shortened life expectancy with Cohen syndrome. So I fully embraced all the geneticist said afterwards, including when she mentioned progressive vision loss, because all of the other symptoms she had mentioned were symptoms that we were fully aware that our daughter had. Vision loss was not. We thought, this is something we can finally be proactive. We can get ahead of the game. And we only found out that we were very far behind on the game. And while she is more than her diagnosis, she's not set apart from her diagnosis. They are important to accurately identify so she can successfully navigate life and not just survive, but thrive. And our experience has taught me the very real fact of you don't know what you don't know. So I strive to dig deeper and discover what I may not know. When she lost services due to a change in a program with our state, I went to Google and reached out to anyone and everyone that was associated with special needs. And it's how I accidentally stumbled upon Family Voices that put me in contact with our state's Parent Training Information Center. And when we finally found some stability in our lives, that allowed me the opportunity to volunteer with that Parent Training Information Center. And I leapt at any opportunity that they brought my way to get connected with other organizations so I could learn more. And as I gained more knowledge, take that opportunity given to me to share that knowledge combined with our experience with others. So while our daughter's vision impairment went undiagnosed far longer than it should have, I do see it as an opportunity. It was an opportunity for us as parents to learn to ask questions, to understand the process and mindset of a provider more. And it's an opportunity for us to share our story now with families, not so they mistrust their healthcare providers, but to see how they are a member of that healthcare team and the important role that they play, and how sharing outside information with that provider gives them an opportunity to support them in ways they may not have otherwise. And it's an opportunity for those that support families, whether it be in healthcare or education or in any other area, to not make assumptions about or for the family. Appointments are often hurried as the provider either is fully booked or falls behind due to a variety of reasons. And there's understandable, but allowing just a little extra time in those appointments with families could help identify areas that need to be addressed that may not have otherwise been discussed. And this is just a snippet of our story. As you can imagine, having an 11-year-old with multiple complexities, I could go much further into detail, but I hope that this portion of our experience helps highlight the importance of the provider-family relationship. Each person plays a vital role. When families allow themselves to be authentic with providers, asking questions, providing information, and taking an active role of educator, partner, and learner, they set their child up for success, even if the provider misses critical opportunities. I understand that a lot of times families, and we were guilty of this ourselves, we thought, well, these are the experts. They're more highly trained than us. And that's true. They were the experts in that area, and we were the experts in ours, which was our daughter. And when we combine those expertise together, we found that we were able to support our daughter in a much more robust way. And when the provider takes the time to offer support to the family, not make assumptions, and humbles themselves by walking into a room expecting to learn and not with their own agenda, they set the patient up for success, even if the family is struggling to execute whatever plan is offered that day. We've been very blessed with numerous providers that ask us questions. They want to learn from us, and they don't enter the room with the end in mind. They enter it waiting to see what unfolds, and that's really benefited our daughter. And when both families and providers can do these things well and together, it sets the patient up for not only success in navigating their diagnosis, but thriving so they can see they are far more than their diagnosis. Healthcare is holistic. It's addressing the person, the resources they have access to, and the obstacles that are in their path, meeting them where they are and helping them make progress forward. Treatment with care and consideration. And that happens through humble providers and advocating families. So I thank you for allowing me to share and for taking the time to continue to hear from the rest of my colleagues who will share in much more detail how this can be executed no matter what your role is.
Thank you so much, Nicole. That was really fabulous. Just a reminder to everybody to please put any questions in the Q&A, and we'll be answering those at the end. So as you saw, Dr. Terry Schwartz is here with us today. She wasn't sure if she was going to be late, so she actually recorded her presentation, but she is here so she can answer any questions live if you have them. So give me just a moment to pull up her recording.
I'm happy to address the issue of vision health in children with special needs. I'm going to use our time to talk about the critical need to identify and characterize problems with vision in this group of children. So let's go on and answer the first most obvious question: why is vision important? Almost half of our brain is committed to vision. Vision is critical for learning, and in addition to intentional visual instruction, we learn through incidental visual experience like simple observation and imitation, visual feedback. The loss of vision has a huge impact on development and can hamper both cognitive and motor development, so we don't want to miss it. Our goals should be to identify vision problems early, to be able to
Donna, the sound stopped for me.
Johnny, you have to unmute yourself.
to the back of the brain, or the occipital cortex, where understanding and processing of the picture begins. The occipital cortex is simply the beginning of understanding what we see. So to take a deeper look at vision processing, let's picture two different streams of vision. First, the dorsal stream, which is called the where or how stream. That is, where is the object? Where am I? How do I use my vision to move through space? And then the ventral stream. What am I looking at? Who is that person? What's in that drawer or pile of toys that I looked at earlier? The child with special needs may have vision problems due to the eyes and optic nerves, or due to the processing of vision in the brain. So let's take cerebral palsy, or CP, as an example. We know that it's a disorder caused by injury or developmental disturbance to the immature brain. It can lead to motor, cognitive, and learning problems. And we know that vision problems are present in 50% of children with CP. We know that the entire visual system is at risk for damage. In fact, the severity of CP is correlated with how severe the vision impairment is. And often vision problems are underreported, partly because kids with mild CP aren't referred for complete eye exams. So I've alluded to a condition commonly called CVI, which is vision impairment from damage to parts of the brain that process vision. CVI has many names. In the US, we call it cortical visual impairment. In Europe, it's cerebral visual impairment. And more recently, brain-based visual impairment, which implies that the injury to the brain that causes vision problems is global. It's not just a local problem. The spectrum of problems from CVI includes difficulty recognizing objects and shapes, problems orienting in space, accurately detecting movement, even visually guiding the movements of our hands, arms, and legs. It is the most common cause of significant vision impairment and blindness in children in developed countries, fully 25%. It's hard to find CVI, it's hard to diagnose it, and it's hard to characterize vision in children with CVI. Children with special needs can have diffuse brain injury and other problems that hamper a thorough, standardized assessment of visual function. They might have impaired cognitive function, or poor or no speech, or maybe impaired motor function. So it isn't surprising that vision impairment often goes unrecognized and is poorly characterized and difficult to quantify. In addition, problems caused by CVI can sometimes mistakenly be attributed to other things like learning disability or behavioral problems, or even missed in the child that has early school success and mild CVI. So how can we as parents, medical professionals, educators, therapists help identify kids with vision problems? I'm going to give you strategies. Let me just list them first, and then we're going to talk about them a bit more in detail. The first and most important is, as a parent or caregiver, the observations that they bring. Taking a focused medical history, a visual behavior history, using screening questionnaires, early assessments of visual function, and then the standard eye exam. The Prevent Blindness website has lists signs and symptoms that help recognize problems of the eyes and optic nerves. Familiarizing ourselves with visual developmental milestones can raise concerns when a child's visual behavior lags behind what is considered typical. This chart from the Aravent eye care system shows some typical visual milestones. Sometimes a child's behavior suggests a visual problem, like clinging to parents in a grocery store, difficulty going downstairs or reaching for an object unrelated to motor problems, having difficulty finding a toy in a heap of toys, or finding their parent in a crowded school. We use focused medical histories. That is, does the child have a medical history that might result in injury to the vision system? In fact, in kids that have good visual acuity, abnormal prenatal and perinatal visual or medical histories is probably the most important factor for finding CVI and in deciding which kids should be referred for more assessment. Here's a list of them. Premature birth, a history of low oxygen or hypoxia, a history of stroke, a history of brain infection like encephalitis, hydrocephalus, a history of traumatic brain injury, seizures, especially poorly controlled seizures or seizures very early in life, drug exposure during the pregnancy, or many genetic conditions. We also use screening questionnaires. They're beginning to play an important role to identify kids at higher risk for vision impairment. They can provide early identification. They can prompt the referral for diagnosis. They can define how vision problems are impacting function and also help with planning interventions. All kids with special needs might be at risk for vision problems, but resources are limited. It's unreasonable to think that everyone can have a comprehensive diagnostic evaluation of their vision. So questionnaires can help us suspect problems with vision. Let's look at 3 of them. The first is the pre-verbal assessment questionnaire. It's used to detect abnormal vision maturation in infants from birth to 24 months. It's completed easily by primary caregivers, yes or no answers. We know it's valid and reliable, and it can detect abnormal visual maturation. The visual skills inventory is used to identify vision problems in kids with neurologic impairment from age 7 months up to 16 years. It's only 11 questions, and it's about visual skills in response to familiar situations. The rapid assessment, or 5 questions, was designed for use in busy clinical practices. It screens questions only reflecting the dorsal stream, or that where stream. And the nice thing is it has no overlap with the social communication questionnaire, which is something we use to screen for autism spectrum disorder. Many children with autism spectrum disorder can have vision problems that can look like CDI. Well, let's talk about the eye exam. A newer trend in nurseries is very early screening of vision and eye health. And one tool that's recently gained traction in the US is the NAVIG, or Neonatal Assessment Vision European Grid. It's designed to test full-term and preterm infants with testing as early as 24 hours after birth. It consists of an eye exam, looking at the pupils, looking for structural abnormalities, looking at eye movements, and looking at vision. Well, what about the standard exam of eyes and vision? First, we look for early vision response, like a pupil response to light, a blink to a bright light, or a response to a spinning drum. All of these being present suggests that there is vision, but remember that none of these involve processing of vision in the brain. Babies are designed to prefer faces above all other stimuli, and so a baby's response to a face is a reassuring sign of vision. We try to measure visual acuity, that is the smallest object that can be seen at the highest contrast. We typically think of measuring vision with a letter chart seen here, but we can modify this using symbols seen here and matching. And this can be completed as early as 2 years of age in children. Well, for younger children, even newborns and children with multiple disabilities who can't complete testing with symbols, we can use black and white stripes of decreasing sizes to help estimate visual acuity, also called teller acuity cards or grading acuity. We do a test to determine the faintest object that can be seen against a white background. This is called contrast sensitivity, and it's as important, maybe more important than visual acuity. Reduced contrast can cause difficulty with safe travel, with reading, and even social interactions, being able to see facial features and expressions. We look at eye movements. Are the eyes still, or are they jumping? Can the eyes fully move to the right, left, up, and down? And are the eyes pointing in the same direction? We check the field of vision. Can the child see off to the periphery of vision? And finally, we look at a magnified view of the front of the eye, as in this picture. We check to determine if glasses are needed. And as in this picture, we look in the back of the eye through a dilated pupil to look for structural problems. Let's look at two children briefly with easily missed but highly impactful vision problems. This parent was concerned that her 5-year-old son couldn't complete his worksheets. His initial exam showed great vision, typical eye movements, good alignment, no need for glasses, and normal structure of the eye. But additional information from his mom revealed that he'd asked for more food when the left side of his plate was full. He ignored the left side of pages and books, and he had to be reminded of obstacles in his path when he was walking or he'd run into them. The medical history that I didn't give you before noted that he started having seizures a while back, and a large tumor was found, which was removed surgically. But when he awoke, he had a mild weakness on his left side due to a stroke during surgery. His mom brought his schoolwork to the appointment, and further exploration showed he was missing the field of vision to the left in each eye. It's easy to imagine the impact on education if this is undiscovered. This 3-year-old couldn't distinguish between her two blonde-haired sisters without hearing their voices. She had difficulty identifying items in picture books and couldn't find her mom when her mom went to pick her up at school. She'd been adopted internationally and initially had been found unconscious on the doorstep of a hospital. Her imaging showed a traumatic brain injury. She had damage to that area of the brain that stores images, in this case, faces, that ventral visual stream. She could walk through a room without any problem. She could pick up small objects, but she couldn't interpret facial expressions and couldn't identify faces, including her family. There are two approaches to testing that I'm showing here. One is a test of identifying facial expressions, and this is a montage of faces, including the patient's own face, which they couldn't pick out. So what information do we need to advocate for any child, but especially a child with special needs? Information that an eye care professional can provide includes the diagnosis responsible for vision impairment. Is vision loss progressive or is it stable? What about a description of visual function, including acuity, visual field, contrast, and color? The level of visual acuity can help determine if a child qualifies for federal funds for devices to enhance remaining vision. Are glasses needed? And if they are, what for? Reading all the time? Could this condition impact education? And are there other visual problems like processing problems that might impact education? So I hope I've convinced you the ability to see and understand what we see as a complex process. Vision problems in children with special needs can be difficult to identify and understand. So early detection of visual problems is critical for optimal development, education, and communication. The eye doctor can be a partner, identifying the presence of a problem with vision, understanding how your child sees the world, and helping to advocate for intervention and adaptations. Thanks very much.
Great. Thank you so much, Terry. That was really wonderful. I'm going to go ahead and come back to the slides now. And we are going to turn it over to Robin Shannon. Let me get to her slides here. Here we go. Okay. All right. Go ahead, Robin. Thank you.
One more. Couple more.
There we go.
There we go.
Sorry.
Yes.
Okay. Just say next one. Ready.
Thank you. Hello, everyone. It's a real privilege and a pleasure to be speaking with you all today about understanding the systems that serve your child. So I saw from the chat that we have family members and educators and healthcare providers and school health professionals and school nurses. So I'm going to try to hit those lenses as best I can, but with a specific focus on the families, schools, provider, and school nursing as a liaison and a team. Next slide, please. And so the educational perspective for our little superheroes is really, really important. I'm going to speak specifically about the education system that takes care of our kids and teaches them from the ages of 3 through the years of 21. Next slide. So I'll start with the Center for Disease Control and Prevention, CDC's whole school, whole community, and whole child model. And this is really important framework to keep in mind as the ideal for serving our kids within the community in the school system. So here we have this student or the child in the center, and we need coordinating policy processes and practices to keep our students and our children healthy, safe, engaged, supported, and challenged so they can succeed both at school and at home and in their life going forward. These 12 blue cogs in the wheel speak to what should be going on in the school system. So there are many factors that are dynamic and they interplay with each other. So we have the health and education. So this is health curriculum, PE and physical activity, nutrition services, health services, and typically talking about school nursing services. And if we're lucky, school-based health centers that coordinate with school. The mental health services that students need through counselors, psychologists, and social workers. The social emotional climate of the school is really, really important to student success, as is the physical environment. We need healthy employees, obviously, and families that are engaged. And the families really, I'm going to keep emphasizing how that they're central and really the leaders of these frameworks and the systems that I'm going to be talking about. So community involvement encircles the child and hugs this whole system so that we can have students that can optimally learn and participate in their school day. Next slide. I know that there have been previous webinars on special ed and federal regulations surrounding the rights of children, but I just want to review briefly that special education under the Individuals with Disabilities in Education Act is the processes by which children are found, are evaluated, are found eligible, and then may or may not qualify for an individual education program at school. So students that qualify for special ed require modifications to their curriculum that should continue through every environment during the school day. And Section 504 plans prohibit discrimination against students with disabilities. And that affords students accommodations in the learning environment and typically to the typical curriculum. So when we're talking about special education, we're thinking modifications, and 504 plans is accommodations. When advocating for children, please keep in mind that both IDEA and Section 504 plans are the civil rights of children, and they are enforced by the Office of Civil Rights in the Department of Education. And so just keep that in your pocket when you're thinking about that. These are the rights of children. They have a right to be educated and they have a right to the services that they need at school. Next slide, please. So school-based services look quite different than home-based services, clinic services, or hospital services. Many children with low vision and special health care needs are identified at birth, sometimes before birth, and receive or during their early years and receive birth to 3 services. Many children, however, are picked up once they're within the age range of the school system, so starting at 3 years old for early childhood. And child find services are also mandated by the federal government, and they should help to identify the students through screening. There are significant differences between educational services and therapeutic services that students may receive. So although educational services are mandated in order to provide students with a free and appropriate public education, they are not therapeutic in that therapeutic services are targeted to improving students' health or function, where educational services are targeted for the most part in optimizing the student's ability to learn and function in the school environment. So there's a little bit of a shift and focus there, which is a transition oftentimes for families. Educational services have to be done in the least restrictive environment, and they have to be reasonable. So we want everything that we want can possibly do for the children. If a child needs a service to access their education, the school district is mandated to provide it. But again, the difference between therapeutic services and this educational services at school is that it has to be able to be reasonably afforded at school. School services are always student-centered. There's a focus on wellness versus therapeutic services may sometimes focus on a student's diagnosis or their signs and symptoms. But in school, it's a well child with low vision. It's a well child with autism. It's a well child with traumatic brain injury. And so we always want to use child first language, saying that these are students with autism, students with low vision, students with seizures, etc. School-based services are always based on the individual needs of the child and not the diagnosis. So we may have children in the same classroom who receive very similar services with different diagnoses. And then we may have students in that same classroom or school that have the same diagnoses and receive very, very different services. Next slide, please. School services are always delivered through a comprehensive team approach. And so these are the integral members of the school team. And starting with the case manager, who is often a special ed coordinator, and that person should function somewhat as a quarterback that is kind of calling the plays and helping to coordinate the services in the best interest of the child. The next box, parents, guardians, and students. I should have made this way bigger than the other boxes because, again, the family and the student are central, and their voice and their viewpoints, their perspectives, their cultural values and beliefs have to be front and center and really, really drive the team. I think of them as the captains of the team. Then we have administrators, which are required, teachers, regular ed, special ed, vision, adaptive PE, etc. The therapists, OT, PT, speech, mobility, and vision. They can help really with the adaptive equipment and technology that kids. Again, mental health services from psychologists, counselors, and social workers. Psychologists in schools oftentimes function mainly with educational testing to help determine the students' learning needs. And then the school nurse who really, if a student needs any kind of health services at school, is an integral member of the team. Next slide, please. So I'm going to talk just a minute about the role of the school nurse. I know we have several school nurses on the call. The role of the school nurse is to reduce health barriers to learning. That is really, really our function. So even though we may be, giving medications or providing procedures or, assessing children or taking care of their, daily needs when they're ill or injured, our overall mission is to reduce barriers to learning. And again, with a student-centered, holistic approach. We can be seen oftentimes as the safe space for students in a school. We're not grading anybody. We're not disciplining anybody. We're not making kids, do tasks. We're there just to support the students, their physical and mental and behavioral health needs. The school nurse serves as a liaison between the home team, the school team, and the healthcare team. So it's really, really important that the communication between the school nurse and the teachers, the providers, and the rest of the comprehensive team remains open, candid, and continuous at all times. Nursing services can be direct, again, like through delivered care, or they may be consultative, working with the teachers and the family and the providers to provide plans of care. And those plans of care can be individualized healthcare plans. Students with potentially life-threatening conditions need emergency care plans. Students who are not mobile independent or may have really low vision need evacuation plans in the case of an emergency at school. And these plans all become integrated into either the IEP or the 504 team. Next slide. Oh, can we go back one slide? I do want to, it occurred to me that when Nicole and Dr. Schwartz were talking, that when school nurses are doing a comprehensive evaluation for special education or 504 eligibility, annual reviews or 3 reviews, vision is always a domain. Just as Nicole said, we never accept that there's no problem with vision. We don't have any concerns. Vision always has to be screened. Unable to test or unable to screen is not acceptable. So students that are undergoing evaluation because they have learning or health needs at school that impact them significantly, they must be referred for further evaluation and care if needed. Thank you. Next slide. So this takes a lot of coordination between the teams. It takes a lot of organization and communication. It's really important that each team designate a point person that communicates with the other teams. So, parents need to designate, the person who's the main communicator in the family, designate the main person that they communicate with at school, and designate the main person from the healthcare team so that there's open and consented conversations, as needed on behalf of the best needs of the child. So a lot of care coordination, a lot of education of the different players and stakeholders, and always we have to advocate for the civil rights of our kids to have a great education and success at school. I think that's my last slide.
Thank you so much. Thanks, Robin. That was awesome. We're gonna turn now to, wait, was this yours too?
Oh, yes, I think I covered that.
Okay.
So
right.
That's just that piece about the whole school, the whole community, whole child, using your community resources, connecting with your local agencies, your organizations, to develop a support network of family work, friends, your church, whoever you can lean on. People love to help, and it's important that community resources and supports all tie in. Thank you.
Awesome. Thank you so much. All right, we're going to turn it over to Nicole Pratt. And there's Robin's references, which you will get when you get the slides. Okay.
Hello. So everything you've heard so far, I'm gonna kind of wrap it up in these next 2 slides and expand on a couple of other things that were discussed. And so I want to kind of just elaborate a little bit more about, when we're going to appointments, whether it's your the IEP meeting, a meeting with the school nurse, meeting with school administrators, if parents are meeting with the intervening referral service team, IRNS team, and preparing for a doc's appointment. So it's really important to have a list of questions. And as Terry alluded, kind of partnering with other people in your community, with friends and individuals, when you're getting ready to go to these appointments, because it can be overwhelming when you're getting a diagnosis. And I can actually speak from personal experience with this, and making a list of questions that you may have when you're getting your IEP meeting, getting ready to attend it, and you're getting a draft copy of your IEP with the educational components and the medical components, especially if there is vision services in there. You want to always review it before you have an IEP meeting. And depending upon your state, will depend upon if your state in their regulations is required to give you a draft. That doesn't happen in every state, so you have to know what that is. But you can request a draft IEP prior to your IEP meeting, just to review it and go over and see if there's anything that was put in there that changes are being made, especially around the medical pieces, especially any conversations you want to have with the nurse, especially if there's any additional information you received from your doctor, from your eye care doctor or other doctors that need to be put in there. So you want to make sure that you have a copy of that before your meeting, if that is at all possible. When you're preparing to go to the doctor, really, really important to make a list of questions, because as it was stated, as parents, we have a lot of information that we need to share with the doctor in order for the doctor to assess and to properly say which eye care doctor your child needs to see. That's really, really important, because that will determine, sometimes, especially with health insurance, is your health insurance going to be paying for that eye care physician? Now, I'm going to talk a little bit more about health insurance in a little bit. So those are really key points around when you're having appointments, whether it's with the school team, the nurse, other educators, doctor's appointments. Make a list of questions, have someone help you, especially when it's overwhelming and you have a lot of new diagnoses and there's a combination of different things. It can be really overwhelming. So have a notebook, or if you're using a tablet or your phone, whatever device or place you use to write notes, really, really important. And then write notes when you're there. I still, to this day, take a notebook to my son, and he's 21, and I take notes at the doctor's appointment, especially if there's things I need to discuss that are really, really important. And so I'm going to talk to you about some websites. So you heard some terminology: parent center. Really important. I work for the Parent Center here in New Jersey. I work for the Span Parent Advocacy Network. And you heard that the other Nicole connected to her Parent Center in Arizona. Parent centers are really a vital source of information and support. And they help families become advocates through training, connecting them to other resources. Many of them are connected with our Family Voices, a Family Voices affiliate, or a Family Health Information Center. If you're not familiar with where your parent center is in your state, you'll receive some links, a link to the parentcenterhub.org. And when you click on that, it's a website that has a lot of different resources, and this is actually managed through SPAN itself, but you can also find your parent center there. So you can click on your state and find your parent center. Some states, because of the state is so large, have more than one parent center. But if you're in California, I think there's like 3. Just call one of them and they'll connect you to the right one, right? And so they're a really good place for information and supports and resources and training, and connecting you to other organizations that can provide support to the family. And Family Voices does a lot of things nationally, advocacy around different bills, but Family Voices also has a lot of different programs and educational things that support families as well. And then you have Family Voice affiliates in every state. Some of them are co-located with a parent center, or some could be co-located with an F2F. So you can go on Family Voices and you can find out where your Family Voices affiliate and F2F is in your state. And then there's also the Office of Special Education Programs, OSEP. You can go there and find a lot of information, and you can also find information and what they discuss on vision assessments and the guidance that they give to states around vision assessments. And again, you have to understand what your state's special education regulations state around what assessments they do. One state may have it in their regulation to do vision assessment as a required assessment, and some states don't. So really always understand what your state does. But if a child needs a vision assessment, the parent needs to say, my child is getting a vision assessment, they got the medical diagnosis, and now the school needs to partner with the organization that will come in and do the vision assessment for educational purposes for the child in school. There's a lot of information on the CDC, and you can just search out vision supports, National Center of Birth Defects and Developmental Disabilities Home. They also have an abundance of information, and AMCHIP, the Association of Maternal Child Health Programs. A lot of information there around a variety of different topics around maternal child health, vision care, and an abundance of information. So these are the ones that I really felt that, people can go to and just kind of peruse around the website, get a lot of information and resources. Sign up for the newsletters. That's the best way of also getting a lot of information of any webinars that they may be doing. If you're familiar with AMCHIP, they're actually having their virtual conference coming up in about 2 weeks. So, there's a lot of things coming your way. Next slide. And so there was a mention about health records. So really important, especially with health records, really keeping comprehensive information around your child's health records. I was always an advocate for asking the doctor. Well, now a lot of things are electronic, so you can get your child's electronic record. But before that, you had to ask the doctor to give you a printed copy of your child's medical record for that day. So that's really important to have your child's medical records. If your child was in the hospital way back when, you had to ask for printed copies. So now the great thing about electronic records, they can, many places have websites that you can go to and get your child's record. So that's really good. Medicaid insurance. So each state has a Medicaid program, an SCHIP program, children's special healthcare needs program within their Medicaid, and they have HMOs. One of the things I want to say about that is that if your child is and understand what your Medicaid program is in your state, because every state has somewhat differences within their Medicaid program. So you want to know what your Medicaid program covers around vision assessment. It's really important to know, and understanding how many times a year you can get that vision assessment done, or vision screening, I should say, through your insurance. Ask what type of vision screening your child's getting done, and if they need a more comprehensive eye exam. Parents should not be afraid to ask these questions and understand what your child's eye condition is. Within the Medicaid HMOs, there's a case manager, really important. You need to be connected with that case manager so that if you're looking for an eye care physician, they can help you look for those things, because it could be overwhelming going on to the HMO health maintenance organization website, kind of scrolling through if you're not familiar with it. But one thing I do say, do become familiar with your child's health insurance, especially if it's a Medicaid one. Understand what it covers. Talk to the case manager. If you have private insurance, same thing. Understand what the coverage is. And with private insurance, many times you have an external vision plan sometimes. So understand what your private insurance is if you're getting it through your employer. So understand what your employer benefits are. Your employer may not have vision coverage, so you may have to buy it separately. If you're getting health insurance through the marketplace, understand what that looks like. You're able to pick But even with that, they will have like basic vision services there. If you need more, you may have to pay a little bit more out of pocket. So understand what those are, and then understand how you get access to those records. It was also mentioned about an individual health plan, really important. A child doesn't have to have an IEP to have a health plan, right? So if a child just has some vision things going on and then getting some vision services in school under a 504 plan, but there's also some other medical needs that need to be supported at school, there should be a health plan that gets written up. And these are the laws that support that: IDEA, Individuals Disability Education Act, Section 504, Reasonable Accommodations, ADA, Americans Disability Act. One of the other resources, and I'm going to send this to Donna, it's in English and Spanish. It's called a health passport. It's a very family-friendly document that the family can fill out and give it to whoever needs to understand more about their child. It goes from feeding, and I think it may have a section for, what kind of supports does a child need in school. So I'm going to send that document out to her, and you can share it with anybody you want. I use it a lot when I do my health advocacy trainings. And speaking of health advocacy, so when we look at advocacy and building our skills, there is, and I researched this. So there's a program called Partners in Policymaking. It looks like it's in about 49 states. And it actually started out in only 38 states many, many years ago. But it is in 49 states, and it's a good program. And if you type in Partners in Policy, if you're not familiar with it, or you can ask the PTI in your state, they will be able to direct you to it, because each state grant holder is different. But it's a great program. I took it when my daughter's 27, so I took it when she was about 2-3 years old. I was the third cohort here in New Jersey, second or third cohort here in New Jersey. And so it takes you to understanding how to be an advocate, not just in school, but for policy, understanding policy and government and things like that. And many of them have been doing virtual. I know here in New Jersey, they're doing a hybrid model. So it's a really good program. If you get into it, I really advise it. And the other thing I want to touch on is understanding cultural differences. So we have to understand that, the world is made up of different ethnic groups, right? And so if a school nurse or a teacher or a case manager says to a parent, I really think Johnny needs a comprehensive eye exam, so that parent may or may not act on it right away, even though you feel very strongly about it, and maybe you've even gotten the information for the doctor because you understand what their insurance is, but they still haven't done it. And so there could be a lot of things going on with that family. And so kind of asking those questions, right? I know you haven't been able to make the appointments. Anything else going on that we can support you with? And so culturally, the family may have another child that's dealing with some other things, and that may not be high priority for that family. So really kind of being culturally sensitive to many different families, and why maybe they haven't made that doctor's appointment, doctor's appointment yet, and just asking questions, because maybe they need help with something else in order to get to that point. So really understanding families' cultural differences and how they make appointments, or when they're going to make appointments, and how they prioritize things that are important for them and their family. And then that lends to supporting families' communication, right? So letting the family communicate to you, and you communicating to the family, really important, because we don't communicate, we can get the lines very blurred, and then things don't come out very clear to anyone about what needs to be done. And so we need to be able to allow understanding cultural differences, but allowing the families to communicate with you about those differences that they share with you, and not be critical of them, but understanding them. And so making sure there's different ways for families to communicate with you. Sometimes families may not communicate with you by phone. Sometimes they may communicate by email, and just being able to track that that communication with them is really important, because without communication, then we won't be clear about what's going on with the family. And so ask questions. The families ask questions, doctors asking questions, school nurses, school personnel asking questions, and then allowing that parent to be able to ask questions and feel safe about sharing information, really important, because many times if parents don't feel safe, they're not going to open up to you, and they're not going to tell you why or what's going on within their life, why it's causing them to be delayed on making certain appointments. Okay. So I want to thank you. Thank you.
Yeah. No, I was going to thank you, Nicole. Thank you so much. So we're going to move into questions and answers. So I'm going to ask all of the presenters, the panel, to put your cameras back on so everyone can see you. And when I just looked, there were no questions. I've thought of a few questions, and I don't want to be a hog, so I'm wondering if any of the, wait, looks like one might have come in. Yay. I am an optometrist and lecturer in Australia. This is from Ravathi, if I'm pronouncing that right, and I'm sorry if I'm not. Interested to add visual impairment in children, for which I wanted to ask some help and guidance for my own understanding of the condition to include basic information. How do I start? So I don't know if that's mostly a question for Sandy and Terry. Yeah, go ahead.
I will let Terry get started because I think her presentation definitely shows she would be able to answer that very well. Terry, you're on mute.
So I think what you're asking is how to find out more information about broadly about visual impairment, and maybe in particular about brain-based visual impairment. And the best way that you can learn, that we can all learn, is by going on to a website that was developed in large part by Gordon Dutton called CVI Scotland. And I think, Donna, I've shared that information with you so that maybe you can post that. There are a series of lectures, some of which are just little bites, like anywhere from 1 to 5 minutes, that that will teach you things certainly that I didn't learn in my residency about how the vision system works and what happens when there's injury to the visual system. So highly, highly recommend that as a starting point.
That's great. Thank you. Yeah, go ahead, Sandy.
So there is a book by Leah Hyvernanen who really has worked extensively with children with special needs. And I think if you go to her textbook, and Kay, if you would, do you have the title of that textbook? I know you worked intimately with Leah. Leah is the same woman who created the Leah symbols, which many of us use to assess visual acuity level in children who are barely literate, pre-literate, or just able to match. So Kay, do you have the name of that textbook? It's available through Goodlight, I know.
Or at least put the name of the author in so everyone knows how to spell it.
The author is Dr. Leah and Namita Jacob. The title is What and How Does This Child See? And if you can open my, open my video, I can actually show it to you.
Well, that is a good question here. I'm making you a co-host, so you should be able to turn your video on.
I'd also say
there you
are. That's a great book, Kay, but I'd also say that Gordon Dutton has 2 books. One is really technical, and the second is kind of slightly lighter fare, but I recommend both of those as well. And I can get that information to you, Donna.
Excellent, thank you. And I'm going to throw out a question, and this is really for Nicole G. And as I was thinking about your presentation and listening to all the other ones, I started to think about how you got support. You know, you mentioned that when your daughter was born, your husband was going through cancer treatment, you had financial issues from paying for the treatment. And, you know, and I heard a little bit of self-blame there. And I'm sure everyone on this webinar was thinking you shouldn't blame yourself, and we hope you don't. And I love that you ended with talking about the opportunities you've had. But I'm just curious how you found support. Like you said, I think you said you found your PTI or Family Voices, I can't remember. And so I'm just wondering, for people who are parents on the call, they're curious where you get the support. And then I think for professionals, how can we as professionals help parents to feel supported? Besides when we're in our offices, what do these other organizations help you with?
Yeah, those are great questions. Thank you for asking those. So a lot of desperate prayer. And when I found organizations, I really stumbled upon them. I was very blessed that I was a stay-at-home mom. And so other than taking our daughter to all of her appointments, that's what took my whole day. So when she lost services and I didn't have appointments to take her to, I had all the time in the world to just Google. And that's what I tell people. It sounds cold, but when you have a child with complexities, I tell people you kind of have to treat that like a business, and it's all about networking. So and it's also giving yourself grace and what's realistic. So there was a season in my life where I was just taking her to appointment, and that was it. And so I had access to our providers and asking them questions, but nothing else. And as our seasons changed, I would get involved with volunteering, reading books, flyers, webinars, newsletters, whatever information I could get. And it would be a lot, but I didn't feel like I had to sort through all of them. It was just available to me. I made folders, paper folders, and computer folders of information, because you never know when you're going to need that information. So for parents, I would just say, whatever information you can latch onto, use whatever resources you have. Church, family, friends, if you're working, if you see somebody at the grocery store and their kid has glasses and your kid has glasses, I realize for introvert people, that's very hard. But you don't know what you don't know, and it's not until you stumble upon those resources. And for providers, I would say do the same thing. Make a folder for yourself. Ask families, hey, do you have any resources I could share with other families? And then you can pocket those. And maybe if you don't have the time, if you've got an assistant, or if you have, some places have care coordinators, but just to give that information, put it out in the lobby on a bulletin board, just to make it available. And I would say, really, if you could get in touch with your, find out what your Parent Training Information Center does. They're required to help families navigate education. A lot of them help families navigate a lot of other systems of care. So you don't have to be the expert on everything, but find one resource that is the resource that can get families connected to others. And once you find that one, then you can just refer families there. And the last thing I'll say is, if you can, refer a family. So instead of handing them a card or paper, because families want to call, but sometimes they don't know what that organization can do for them, and they're already overwhelmed. And so making another phone call, it actually adds to the burden and guilt of, I have to add this to my list. But if it's someplace that you can refer them to, just ask them, hey, I'm sure you've got a lot on your plate. Would it be helpful if I could have them call you? And some organizations will do that, some won't. But if that organization will, then great, you refer the family, and now it's not on your plate and it's not on their plate, but you've connected them to where they need to be. So that's what I would say.
Thank you so much. That was fabulous. We have another question that's kind of a technical question, and Dr. Schwartz, we're going to push this to you. Can you see it? This is from Maureen. We have recently enrolled a child diagnosed with optic nerve hypoplasia. He does not wear glasses and teachers indicate that his vision is fair. They worry that he sometimes suddenly says he cannot see anything and seems distressed. Is this normal and what should they do when this happens?
So it's an interesting question. And I would say that kids with optic nerve hypoplasia, the good news is they're not at risk for progressive eye loss. They have stable vision, but most of them, even with mild loss, have nystagmus, which is the, dancing to and fro movement of the eyes. And nystagmus is a condition that as the eyes move faster, as there's more movement, the vision is more blurred. It's more difficult to discern details. So when does nystagmus get worse? When you're tired, when you're stressed, when you don't feel well, and when you're working really, really, really hard to see. And that may be what that child is trying to tell you is I'm worn out. I'm working so hard. My eyes are jumping so much. I really can't see this anymore. For these kids, a lot of times what we do is ask the teachers to, if they get a concept, don't answer 20 questions, have them do questions. So basically, and I'm hoping I'm seeing my educator here saying the same thing. Basically we're trying to decrease the stress.
Thank you.
Can I add a couple comments about optic nerve hypoplasia? It's a very unusual disease or anomaly because it could have a very mild effect on vision or it could have a very severe effect on vision. So that's always a challenging one to know exactly what the expectations are of a child. And the other thing is it really does not influence whether the child has a need for spectacles or not. A need for glasses for nearsightedness or farsightedness is based on the size and the shape of the eye. Optic nerve hypoplasia is more the connections that Dr. Schwartz talked about between the eye and the brain. So there's a lot of unknowns associated with the diagnosis. And when I worked with children with optic nerve hypoplasia, I'd always, have high expectations of giving them the opportunity to respond at a higher level, but be prepared for them not to be able to do that. So I'm not to make things more complicated, but it's an interesting entity.
I think that, Sandy, that's such a great point about glasses and how it doesn't always relate to what the vision is. Thanks. That's great.
Well, thank you, everybody. We have just a few minutes left, and I'm actually not going to reshare the screen. We have some resources, but I think I'm just going to send that out. One thing I wanted to mention is, and Nicole had some great information on advocacy, and both Nicole's talked about advocacy. Nicole Pratt had a resource on advocacy she mentioned. And I just want to mention, and Nicole Gaici's been through this program, we have a patient empowerment program at Prevent Blindness called Aspect. And it is a great way to learn how to tell your story. How do you advocate for your child? Or it could be for an adult. So it's the whole gamut. It's caregivers of either a family member who's an adult or an older child or a young child. Nicole went through the program as a parent. And we're going to be recruiting for our next group. So Anne, thank you. Just put in the link for the Aspect program. So I just want to really talk that up. We brought all of the graduates together in DC this week, and they really enjoyed all being together. And so it's just a great way to learn how to be an advocate, both for policy, in DC and in your state level and your school district, really learn how to speak up for yourself. And we have a lot of resources, patient education on our websites. I'll be sending that out. Lastly, just want to make sure you have the evaluation link. Anne is also going to give you that. She's right now saying where you could get all the links for to look at the bios, the full bios. I gave very abbreviated to save time. I will just end by saying that this was just such a fabulous day, and this was really about partnering. How do families partner with providers, partner with all the 8 organizations? And I think everybody talked about that. And I think having 2 eye care providers here just shows the openness of providers, eye care providers, to work with families, make sure we're doing the right assessment, make sure we're referring kids to get care. that is what Prevent Blindness is all about, bringing eye care to Americans. And in hearing the important role of the school from the perspective of the school, right, through Robin, and then from the parents, from the two Nicoles. So I just really want to thank all of our presenters. And if you have follow-up questions, funnel them to me. You'll get a follow-up email from me tomorrow. You'll have my email. I can get them out. And again, I want to thank all of our presenters and really all of you who are out there doing the work and who are out there as parents, taking care of your kids. And I just want to wish everybody a really happy May. And thank you so much for being with us today.
Thank you.
Thank you.